Hello everyone, my name is Dr.
This crazy living's got you out of control. It's so beside you when you're losing your soul. Whoa. She looks you over with your luck and your health. No passing on you when you're all by yourself.
Dr. Owens Chiropractic of Bellevue. Welcome to our new office. Today I wanted to go over with you a typical office visit, which is a treatment that we do every day, the checks that we go through, what we look for and what we correct on the spines to help the people's health every single day. So today we're going to use Kate as our model, and she's going to help us demonstrate this whole thing. So Kate, let's have you start out face up on your back. Now, typically we'll start out face up on the back because I need to address the cervical region or the neck. So as we check through the neck, the main thing I'm looking for, as we've talked about in my other visits, is both misalignment but also the ability of the spine to move freely. The free motion of the spine, every bone of the spine, that's essential for health and nerves and nerve health in the area. So as we check, we see that there's some slight fixations and bones out of place in her lower neck, so we're going to go ahead and correct those. We wouldn't necessarily use this manipulation on kids or elderly people, but for someone like Kate, it's perfect because we're able to restore that little bit of motion in there. And we'll do the same thing, that lower neck here. Good. Excellent. And we'll come back to that in a little while with the instrument to just fully restore it. But I found that using the manual adjustment first really gets the big problems out of the way, and then we're able to fine-tune it with the instrument later. So we found the misalignment in her middle back here. And we're just going to free up the motion in that area. Now we're going to check her lower back. Turn towards me on your side, Kate. So as we go through systematically this spine, there may be other problems that take precedent, but on average, I'm going to check things in this order. You can see with my hands, I'm motioning the spine. I'm using her hips to motion the spine to feel what's moving and what's not moving and what's jammed. Kate has a bone that's jammed in the upper lumbar area, so I'm going to contact this. Do just a little correction there. Okay, Kate, let's go on your stomach, face down. Now, typically after we check the main areas, there's some fine-tuning that needs to happen. And for that, I use the arthrostim. You may have seen the arthrostim on my other videos. It's just a tapping instrument that introduces motion into the spine. So we're going to just work the spine. Kate has an older injury down here in the lumbosacral region, so we're going to just free this up. And I free it up until I start to feel that nice springy function. That tells me that we've introduced all the new motion that we can, and the body has to go. The body has to do the healing process after that. Ultimately, what we're doing is we're freeing up what motion we can for the day. And then the body, the patient has to go home, and the body will start to reconstruct the area and do the healing. The healing takes place at home in between visits. Almost like when you're working out at the gym. You don't get bigger and stronger while you're working out. You get bigger and stronger after your body heals from the workout. Okay. There's an area in Kate's mid-back that we're going to touch up. Right here. This is an adjustment that actually does help restore the cervical curve. Many of you that have seen chiropractors before maybe have x-rays where the normal healthy curve of the neck has been lost. This helps restore that, or at least the function of that area, so that you then don't go on to develop the arthritis that comes from having bones that are being stuck in the same place and not moving. So Again, our whole goal is restore the function and motion of the spine. A healthy, movable spine does not develop arthritis. A healthy, movable body does not get sick. So, this is a very gentle rib adjustment that I've been working with and developed to kind of allow the rib cage to move so that full breathing can occur. Energy levels improve when the breathing occurs normally. A lot happening during a real typical office visit, and a lot that we decided to include in our just routine protocol, mainly because these are the things that, due to the stresses that we're experiencing in life, the body needs. So we'll just continue to work that out until we feel that nice springy motion where it was really tight before. Just a touch up there. Now, at that point, Kate normally does this. We've restored all the motion and function into the spine that we can for that day. Now, I like to just use a device called the Genie Rub or the Master Massager. And what we're doing at this point is putting vibration into the spine. It's taking the areas of correction that we've done and we're like enforcing it. We're putting the shellac on it, so to speak. So we're wakening up the whole body, enhancing all those nerve impulses so that healing occurs that much faster. It also can remove any residual soreness that may exist. So this is normally the part that my assistant Kate, who I'm working on, she'll normally be doing this part of the treatment with you, and quite frankly, it tends to be the part of the treatment that people like the most. So don't worry, we won't skip you on this process. If you're in here for the treatment, this is included every single time. So. Make sure we get all those muscles down the side. I'm Dr. Owens, chiropractic of Bellevue. We're here at my office. Hope you're having a great day as well. I wanted to show you a quick exercise today to do at your desk to help neck pain. And before we show you the exercise, I want to make sure that you understand, don't push into pain on this. Just move to the normal range of motion. Don't force anything. The motion is meant to be a nice, easy exercise. The exercise is called Yes, No, Maybe, and it's the motions that the neck are designed to do with the way the bones are shaped. The neck is designed to move back and forward, left and right, and side to side. Those are the three motions the neck is built for. And so what we want to do, we want to reinforce those motions so that they happen easier. As the joints move easier, it brings fluid and nutrition into the joints, helping it to be healthy. Movement causes that to happen. Here's the yes, and we just want to do it 10 to 15 times. Nothing really complex about this motion. Here's the no. Right and left, 15 times. As you do it, you'll notice that your neck gets looser. If you can only go to here before it starts to hurt, only go to there. That may be your motion. That's okay. And the maybe, side to side, 15 times. As you work these, work them 1 to 2 times a day, or if your neck feels uncomfortable, it'll help you feel a lot better. A couple of things that I want to caution you to avoid doing, and that is the rolling of the neck. That is commonly taught in martial arts classes and things like this. Very bad for the neck, especially in this back quadrant here where you're going back. Don't be doing that. It compresses the bones and the nerves, and it'll actually cause things to get worse. The second thing I want to caution you against, when you go to side, don't arch away. The tendency is to try and get that. You want to try and get the elbow to the shoulder. Well, that's not the goal. The goal is not to get the elbow to the shoulder. It's just to maximize your motion. So keep the head nice and straight. Do that 15 times each direction, the yes, the no, the maybe, and you'll have a healthier neck for life. I'll show you an instrument that I use in my practice every day, and it's a super little adjusting instrument called the ArthroStem. And it's an electronic version. Some of you may have heard of like the Activator It's a handheld clicking instrument that puts a force into the bones. This is an electric one, and it does a tapping motion into the bones and allows me to adjust safely at a lower force. I can adjust people that are very old or very young with a high degree of safety with this instrument instead of using a manual thrust. So I'm going to bring Les in, and we're going to demonstrate this this technique, and I'm just going to show it to you on a neck, which is one of the ways that we can use this. Is we'll feel a portion of the spine that's not working correctly and is out of its correct position. And here I'm using the double tip, and we'll position it right where we know that bone's out of place. And so we can begin tapping, which begins to build motion into that joint, helping it to move better, be pain-free, and be healthy. And what's unique about this instrument is we apply the force. We can take the patient literally through a range of motion, adjusting this patient where the restrictions are. Now, Les has a restriction going backwards, so we can apply an adjusting force while he extends through the spine, helping him have a greater range of motion and greater health in those joints of his neck. So we can also go forward and also work the side-to-side motion. This is really beneficial in cases that have arthritis in their neck, that can't tolerate manual adjustment. So